The broadcast is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is Monday, August 1st. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration, and we welcome you to the Fiscal Management Community Service training. I'd like to introduce our panelists for today's presentation and fair. Please welcome Monica Harari, DDA Program Manager for the Fiscal Management Counseling Services. We also have Robert White, Director of Administrative Services. We have Rhonda Workman, Director of Federal Programs and Integrity. We have Christy Culbreth, Statewide Coordinator of Self-Directed Services. And also today we have three new FMCS providers, Kirsten Capeless and Rob Lewis from GT Independence, Lee McCarg and Tracy Davis of the Arc of Central Chesapeake, Chantel Talley with Public Partnerships, Sandy Kasperzak from Public Partnerships. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two ways to hear the webinar, by computer and phone. And if you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. There is one handout for this webinar which can be uploaded, or if you're listening by phone, you can request that be emailed. We have a few polls that we're going to do today, and they will be towards the end of the webinar. We are also recording the webinar and making it available on YouTube and on the DDA website. Any questions you have can be typed in the question box, and we'll probably get to those by the end of the presentation. So now I'd like to introduce Monica Harari. Hi, Monica, how are you?
Hi, Donna. Thank you. I'm doing well. Can you just put on the next slide? Thank you.
Yeah, give me just a second.
All right. So good afternoon, everyone. My name is Monica Hariri, and I am the FMCS Program Manager. Here is our agenda for today, and we will begin with opening remarks from Secretary Carol Beatty of the Department of Disabilities, Deputy Secretary Bernie Simons of the Developmental Disabilities Administration, and Deputy Secretary Steve Shue of Healthcare Finance for the Maryland Department of Health. Thank you.
Yes.
Once again, welcome to the Open Enrollment Virtual Information Fair Kickoff. Today is an opportunity to meet and hear directly from the 3 new FMCS agencies. The purpose of this webinar is to kick off open enrollment and provide you with valuable information that will assist you during this process. Later, there will be a chance to ask questions. Next slide, please. Anyone who currently self-directs will need to choose from one of the 3 agencies during the open enrollment process, which begins today, August 1st, and continues through November 15th. If a participant or their legal guardian or designated representative does not choose an FMCS by November 15th, one will be chosen for you. More details about this process will be presented by other speakers. Next slide, please. Throughout the month of August, you can also attend informational fairs throughout the state. During these events, participants will have an opportunity to meet the new FMCS providers in person. There are several fairs that will be, registration for all events is available via constant contact, and the dates and locations are listed below. Afternoon and evening sessions are available for all events at 12 to 2 and 5 to 7. Choose the event that is most convenient for you. As you see here listed, we have an Easton event on August the 4th, later this week. We have one in Columbia on August the 11th. There's another in Hagerstown on August the 17th. And finally, for the month of August, we have one in Bowie on August the 23rd. Next slide, please. Our next presenter is Christy Colbreth, the statewide coordinator of self-directed services.
Good afternoon, everyone. It's so lovely to be on the call with you today. As Monica mentioned, my name is Christy Colbreth. I'm the statewide coordinator of self-directed services for the DDA. I'm really excited to be able to share this information with you today. I'd first like to review what we're talking about when we say financial management and counseling services, or FMCS. FMCS agencies will support Marylanders who self-direct their services. The FMCS will replace the use of the Fiscal Management Service, or FMS. The FMCS agencies will complete the same activities and tasks that the current FMS does, but with enhanced support and services, like web portals with real-time reports so participants and their teams can log on at any time to check their budget spending. Online, phone, and in-person customer service, including a response to questions in 1 business day. Smartphone and tablet apps for timekeeping and approval, and multiple languages and other accessibility features. Next slide. I'll now review the process of open enrollment for people who are currently self-directing their services. There are 3 steps to open enrollment. Number 1, learn as much as you can about each FMCS agency. Then choose an FMCS agency. And finally, take action steps to transition to your new FMCS. Open enrollment for FMCSs begins today, just like Monica mentioned, and it'll go through November 15th. And if you don't choose one by November 15th, one will be chosen for you. It's important to note that if you are currently using the Arc Central Chesapeake as your FMS, you will still need to choose an FMCS agency during open enrollment. You may choose from any of the 3 FMCSs, including the Arc CCR. Next slide. The first step in open enrollment is to learn about the new FMCS agencies. Today, connect with each FMCS agency and ask them questions that are specific to you. In our slides today, we have contact information for each agency so that you can contact them outside of this meeting to discuss more. Meet with your team to talk about what you learned today. You can use your CCS, support broker, and other team members to help you make this decision. Next slide. The next step of open enrollment is to choose an FMCS. Participants who are currently self-directing may choose to start their new FMCS services on October 1st, 2022 or January 1st, 2023. Choosing an effective date gives the participant and the team time to meet and transition to their new FMCS. The October and January 1st dates are both at the beginning of a tax quarter, making the transition as simple as possible for participants, their employees, and vendors. When you choose an FMCS, you must tell your coordinator of community service. The CCS will confirm your choice and complete the FMCS participant choice form. The CCS will then assign the agency to you in LTSS Maryland. Next slide. The final step in open enrollment is to take action steps to transition to your chosen FMCS. With the support of your CCS and other team members, update your budget sheet to include the FMCS fees. The newest version of the SDS budget sheet includes a line item for your FMCS and has helpful tools to help you calculate how many months you will need to budget for. Make sure your employees and vendors know your FMCS choice. You can let them know that there will be no missed payments during the transition process. And meet with your new FMCS team to make sure all of your employees and vendors have the correct paperwork for payment. The FMCS team will show you all of their processes during this time. Next slide. The steps for choosing an FMCS are different for people who are considering self-direction and for those who may be transitioning to self-direction right now. For people who are considering self-direction, and that means people who want to transition from the traditional model to self-direction or transitioning youth who are choosing self-direction for the first time. Please make sure that you learn as much as you can about the FMCS agencies. After listening today, you can connect with any of the agencies using the contact information we provide. Once you have chosen an FMCS, you'll need to choose an effective date to start your services. For you, this date does not need to be October 1st or January 1st. You can start your self-directed services at any time. Your CCS will send a service referral to your chosen FMCS in LTSS Maryland. CCSs, just a note, you do not need to complete a participant FMCS choice form for people who are starting to self-direct. That form is only used for people who are currently self-directing. Next slide. Once you've chosen your FMCS and are ready to begin your self-directed journey, you will need to make sure your PCP and budget are complete. Your PCP, the participant agreement form, the rights and responsibilities documentation, your SIP, and other documents to show assessed need will be sent to the DDA for approval in LTSS. After the DDA approves your PCP, you will send your budget sheet, family of staff form, and any wage exception forms to your chosen FMCS. They will make sure those documents meet program standards before you can begin your self-directed services. Next slide. Now I'd like to address any folks who have recently submitted a self-directed PCP in late July or plan to send one very soon. You also should learn as much as you can today about each FMCS. After listening today, make sure you can connect with any agencies using the contact information. You'll choose an FMCS and effective date. It can be any date that you want your services to begin. Next slide. If you've recently submitted an initial plan or want to in the next week, your action steps will be a little different. You should use the updated budget sheet to include the FMCS fees for each month of the year, but submit your PCP and budget and all documentation together to the DDA. Meet with your FMCS to start your services when your PCP and budget are approved by the DDA. Now, I know that was a lot of information. If you have any questions about what you need to do to choose an FMCS in the next few months, please contact your self-directed services lead in the regional office, and I'm also happy to provide any support as well. Now, I'll turn it back over to Monica to introduce our FMCS agencies.
Thank you, Christy. Now we'll hear from our FMCS agencies. GT Independence will go first, then we'll hear from the ARC, followed by Public Partnerships. Next slide. Welcome, Kirsten and Rob from GT Independence.
Thank you so much. Thank you so much, Monica. Like Monica said, my name is Rob Lewis. I'm here with my coworker, Kirsten Capeless. We're so excited to be one of the 3 great providers that have been selected to provide FMCS to individuals in Maryland, and we look forward to providing more information on GT. Next slide. And actually, you can go one more slide. So what we plan to talk about today in our presentation is tell you a little bit about GT and our backstory, provide you some information on our customer service, what to expect from the enrollment process when utilizing GT, how individuals will submit their time through GT's caregiver app, what type of resources and reports you're able to access through the GT portal, and then provide you contact information and rates for GT Independence. Next slide. So GT Independence is a family-owned, disability-led organization that focuses 100% on financial management and counseling services. We do not have any other lines of business and really focus on this niche market. We have grown since 2004 to serve now in 20 different states, serving 40,000 individuals. And as you can see here in the picture, the company was started based off of Ben, who has a developmental disability. And our current CEO in the right here, Holly, has a daughter, Maggie, who is also on the spectrum and receives services. All of our technology and services that we use for individuals is tested by those individuals and utilized by both Ben and Maggie. Next slide, please. So a little bit of background on customer service and the expectations that you should receive from GT. Next slide. So first, when reaching out to GT Independence, we have a very, our 35-second to a live person, excuse me. So we utilize a very sophisticated system that call routes every individual to customer service associates that are familiar with the program, understand the laws in Maryland, and can answer any questions that you have there. We also look at how often individuals get their resolution within that first call. So 90% of the time, individuals will call in and not have to have a follow-up call or call back to receive an answer. And for those 10% that we're unable to answer on the first call, we're able to do that within 1 business day or on average 8 hours. We don't measure things such as how long individuals are on the phone, so please take all the time you want to make sure that all your questions are answered. We do biannual customer satisfaction surveys with employees, participants, and CCSs. And on average, annually, we have a 97.1% customer satisfaction rating. We're also very culturally sensitive. GT staff members speak 22 different languages, and then we have access to over 200 different languages as needed. Next slide, please. So I want to take a minute just to talk a little bit about GT referrals and enrollments and what you should expect there. Next slide. So as GT receives a referral, we then immediately start the employee eligibility checks to ensure that those employees are eligible to provide services. From there, we reach out to both the individual served and any of their vendors or providers to schedule a meeting. We then deploy what we call enrollment specialists to either meet with you face-to-face in your home or virtually to go over all of the necessary paperwork to onboard to this program and execute them timely and efficiently, and then provide follow-up and ongoing communication to all stakeholders. Next slide. How we do this is through a platform that we call GT Enroll. So all of our documents are electronic. We're able to ensure that those are completed within the first time that we send something off. So it doesn't, one of the things that we've heard from stakeholders is packets are sent out, they're sent back, they're not fully complete. Through this process, we're able to ensure that it cannot be submitted or sent back to GT without it being accurate and complete. You can ensure that this system is also HIPAA secure, and you're able to access all of this data through any computer, tablet, or smartphone. And with that, I'm going to pass it over to Kirsten to talk a little bit more about GT Caregiver app. Next slide.
Thank you, Rob. So I'm going to talk to you about our GT Caregiver app. Next slide, please. Our GT Caregiver app was designed by us to be used specifically for individuals that are self-directing their services. We knew we needed an EV compliant timekeeping system, and we wanted to make sure it fit exactly our needs in the self-directed world. So you can create EVB time entries. It's actually very easy to use. We have customer satisfaction ratings and voluntary usage of almost 90% voluntary usage, and over 75% of the people say it's easy to use. And those are individuals, some of which are in states where it's mandated, like Maryland, and some of them are in states where they're just learning about EVB and bringing it on. Within the timekeeping system, you get very fast approval because you have control over submitting it directly to the participant, and then the participant yourselves can approve the time. We also added little bells and whistles or extra features into our system to make it even easier based on user feedback, like notes and task features. So you can go right from a checklist and select all the tasks that were completed on shift, and you can click the little microphone and actually talk into it and tell your notes to the system, and it'll capture it for you. It's available in both English and Spanish, and of course, free to download. Next slide, please. We think it's really important to make sure that not only the caregiver or employee is signing off on their time, but each participant also signs off on the time to acknowledge that that time happened in the way that it was documented, and also to ask for any changes that may need to be made if something was entered by error. We also have the ability through our GT portal, which I'll talk about in just a second, to be able to have a representative or employer of record sign off on behalf of the participant if they're not signing off on their own time. Next slide, please.
As we transition, just one thing I want to add on the EVB portion is the only time that we are tracking or getting the GPS location is during clock in and during clock out and during shift approval. So there is no tracking of where individuals are going between clock in and clock out. So I just wanted to be clear, we tried to make that as simplified as possible.
Such a great point. Thank you, Rob. So next slide, please, and I'll tell you all about the GT portal. So the GT portal puts all the information right at your fingertips. When you log into the portal, you come right to the portal dashboard. You can see down the left side a ribbon of quick and easy accessible items, including the dashboard, reports, resources, timesheets, find a caregiver. I'll go through all of those in just a second. But most importantly, you can customize your dashboard to have exactly what you want on it. You can pin your very favorite reports, and you also get notifications from us right there. So all the important information that you need to know is right there when you log in. Next slide, please. We have quite a few resources available inside of our portal, including the user guide. We also have information on how to use the caregiver app, as well as other information that you may want at your fingertips. In addition, we have over 13 standard reports, as well as customized reports specific to Maryland inside of the report tab on the portal. We also have live support and customer service support. Our customer service associates use the same system for timekeeping. So they are the best experts because they're using it every single day themselves. So whether you want to reach us by chat, you want to reach us by email, or you want to call our customer service line, whoever you get on the other end knows how to use it because they use it all day, every day. Next slide, please. We know finding staff and making sure all of your hours are filled is so important when you're self-directing your services. It's one of the best ways to predict staying healthy in your own home. So we want to make sure that you can fill all of your hours and have all of the staff available to you. Many people already know quite a lot of people that they want to hire, but some people have extra hours that they need to fill. So we have the caregiver link, which is available right inside the GT portal. So inside of that tool, you can select things like distance through zip code, language spoken if you want to make sure your staff speak a certain language, and other searchable features. And when you enter in all of those things, you actually get a list of staff in your area that are looking for extra hours that are already vetted for the Maryland program. So it's a wonderful tool where you still have all of the power and authority to pick from that list who you might want to hire. You still interview and make that choice and selection, but it helps bolster the amount of people you have working for you, and you can also build backup plans if that's something that you need. Next slide, please. So I wanted to make sure you had our customer service email, which is a great way to reach us. You can also call our toll-free number. As Rob said, you get routed to an expert that's familiar with Maryland policies and procedures and can answer all of your questions inside of that first phone call. So it's an 877 toll-free number. We have our website as the next piece of information on this slide. So that way you can go to our website. We have Maryland-specific pages. We have access to the portal. All the information you might want to know is right there as well. And I wanted to let you know that in Maryland, each of the vendors has set their own per member per month fee. So the FMCS fee for GT Independence is $123 per month. That includes access to all of our customized features, our caregiver app, our portal, as well as our customer service to assist you with any questions you may have. I also wanted to let you know across the country, we pride ourselves on having competitive caregiver wages. So we make sure to charge the least amount possible to make sure we negotiate and get the best worker compensation rates for insurance as possible, so we can pass through all of the extra money to your employees so they get the highest pay wage as possible. Next slide, please.
So I know we threw quite a bit at you for you to learn here in just this first 10 minutes. We're more than just a payroll company or just a customer service company. Here are some of the other items that we also will provide for you. We'd love to talk with each of you more about each one of these. So as you look through this slide deck, and if you want more information and you contact us, we'll be happy to talk more about any one of these 10 items. And then finally, on the last slide, I believe, is the contact information for our Director of Relationships and Kirsten.
We love getting to meet you virtually, and we also hope we get the chance to meet you at one of the in-person fairs. We'll be there at them all. Thank you so much.
Next slide. And so thank you again. I'll pass it back to you, Monica, and look forward to hearing from anyone that wants more information on GT.
Thank you, GT Independence. Next up, the Arc of Central Chesapeake region. Next slide, please. Tracy, Lee.
Hi, good afternoon, everyone. My name is Tracy Davis. I'm the Vice President of Self-Directed Initiatives for the Arc Central Chesapeake region. Co-presenting with me today is Lee McHarg, Director of Employer Resources. Lee and I will be sharing with you what we think would be helpful for you to know about the ARC as you are assessing your provider options. We also want to express that we are grateful that the Maryland Department of Health insured participants would continue to have choice of their FMCS provider under the new service contract. It's important that participants have a say in who supports them. Next slide, please. When getting to know an organization, it's worth looking at the company's roadmap. That begins with a review of the company's vision, mission, and values. You can see that the ARC's focus is on the person living the life they choose. The ARC's role is to promote access to the services they need to make that happen. Next slide, please. It's also important to look at a company's history. So the Arc Central Chesapeake region started with a promise by a group of parents who envisioned a different future for their children than was available to them in 1961. Since then, the Arc has grown dramatically and now supports thousands of people with disabilities and their families each year. The Arc's programs and services support the full spectrum of a person's life, from birth through retirement and all the joys and opportunities in between. Next slide. At this time of open enrollment, we know you have a choice regarding who supports you throughout your self-directed journey, and it's an important one. We want you to have all the information you need to make the most informed decision possible. Why would you choose the ARC? We think the ARC's history with self-direction in Maryland, our relationships with key Maryland stakeholders, our customer-centric approach, and our commitment to transformation are all important reasons why the ARC stands out as the clear choice. Lee?
Next slide, please. The ARC has shown its commitment to self-direction by serving self-directed Marylanders for nearly 20 years. The ARC continues its commitment to self-direction in Maryland by building the necessary infrastructure to build the growth and fulfill the need for robust program integrity and accountability. As a longtime Maryland-based nonprofit organization, the ARC has developed valuable institutional knowledge from its experience and believes the continuity of service is of paramount importance. The ARC currently serves 1,800 program participants statewide. Next slide, please. On your self-directed journey, you need someone you can count on who knows Maryland-based resources, advocacy groups, and key contacts you need to know. Across the ARC's 60 years as a Maryland provider and nearly 2 decades of serving self-directed participants, we have developed deep-rooted community connections that will benefit you. The ARC has partnered with Maryland-based support broker agencies and centers for independent living with whom we have long-standing relationships to ensure FMCS counselors are available in participants' local communities across the state. Due to our legacy services, the ARC has also developed networks with CCS agencies, as well as veteran support brokers and administrators for the state of Maryland. Next slide, please. The ARC takes a customer-centric approach towards services. In self-direction, you are the boss, but understanding how we can help is critical. It's our role to provide you with the information you need to make important decisions. We have an experienced team ready to help you navigate through common challenges. The ARC prioritizes timely, professional, and thorough responses to your inquiries. Based on the 2021 Annual Participant Satisfaction Survey results, 98% of participants agreed that the ARC team is professional and courteous. 97 report the likelihood that they will continue to rely on the ARC as the provider. The ARC is here because of you and here for you. Next slide, please. For those currently being served by the ARC, you will notice the state's new program requirements and processes, but we will work with those we serve to successfully maneuver and adapt to the new requirements. While there will be changes that you can expect, we are committed to continuing to deliver a high level of service and support to navigate the changes and safeguard service continuity. We will build the bridge for our participants to new tools, providing automation and modern approach to our legacy services. Through the implementation of new software, we will ensure we can establish the compliance the state requires while making self-direction easier and more convenient than ever. Next slide, please.
FMS Engine, our new purpose-built software, is launching this fall, and it will add transparency to our services and will make information easier to access. The ARC knows that when you choose to self-direct, you experience greater autonomy and at the same time accept more responsibility. Well, FMS Engine will act like a personal assistant to ensure things get done right. Here are some of the benefits. The system provides a participant dashboard with real-time spending information, so you know exactly where things stand. The system automatically links your payments to your budget, so you will know what's been processed and what's still pending. Automated employee onboarding is available through a self-service portal, which will help ensure the ARC receives correctly completed forms for your new hires, and it's HIPAA compliant and secure. Your team has access to electronic timekeeping to ensure electronic visit verification or EVV compliance is in place. Online training resources will be available for your team and for your employees. Logging in is super easy. You can use it anywhere there's an internet connection. We are really excited about how FMS Engine will make self-directing easier for all those we serve. Much more information about FMS Engine will be coming soon, so please be on the lookout. Next slide, please. All participants served by the ARC will be assessed a $200 monthly FMCS fee. Also, the ARC will use the same 14% rate for taxes and employer-related fees that you're accustomed to through using the budget process. That rate may differ from provider to provider and can impact your cost, so it's really important to be aware of it. Beyond the traditional role for the FMCS, the ARC is bringing the value-added benefits that we discussed during today's presentation. You'll benefit from the ARC's 20-year history as the Maryland provider in self-direction, our relationships with key Maryland stakeholders, our customer-centric approach, as well as our commitment to supporting you through this transition. If you are an ongoing participant, you will also benefit from the ease of service continuity. Ongoing participants will not need to re-enroll as an employer, nor will they need to submit new hire paperwork for their employees if nothing has changed. And that avoids the potential for any disruption of service during a time of transition. However, please remember that all participants, even those choosing to stay with the ARC, must work with their CCS to complete and submit the FMCS provider selection no later than November 15th, or they will be assigned a provider. Next slide, please. Based on annual participant satisfaction survey results from the last 3 years, participants and their teams have provided a lot of great feedback, which we've used as a barometer to determine how we're doing in the eyes of those we serve. These are some of their direct quotes we'd like to share. Quote, "We appreciate the commitment and quality you bring to your services and the timely way staff responds to questions and concerns." Quote, "A lot of great folks that really care about folks with disabilities. We've really come to love working with the ARC. They're quick to respond about any concerns we have. They provide a great service and they just keep getting better all the time. Highly recommended." And last quote, "Payroll services and accounts payable team members are awesome. They're always polite and answer all questions in an easy to understand explanation." These are just some of our favorites. Next slide, please. Lee and I are hopeful that the information that we shared helps you to better understand the benefits of choosing the ARC as your FMCS provider. If you still have questions though, we're here for you. Our website is a one-stop shop for tons of great information about enrollment process or any other questions you might be leaving with today. You're also completely welcome to reach out and just give us a call. We'd love to hear from you. Thank you for your time to learn about our organization, and the ARC looks forward to working with you, MDH, new stakeholders, and additional FMCS providers to support Marylanders with disabilities that self-direct. Thank you so much. Monica, I'm going to hand it back over to you.
Thank you, Tracy and Lee. Next up is public partnership. Next slide, please. Chantel?
Hello, everyone. This is Chantel Talley. I am one of the account managers with Public Partnerships. I look forward to speaking with all of you soon, but today we're going to go through our slide deck for public partnerships and the services that we'll be providing in Maryland. Next slide, please. So we put together a great presentation that lets you know what are the 3 reasons why you would choose PPL as your FMCS provider. Here we have one of our participants who's been self-directing since 2018, Anita Paris, and she wanted to join in our presentation, so we went ahead and commissioned her for a picture so she can be added as a participant. Next slide, please. So I want to talk to you about some of the financial benefits that you and your loved ones and your providers will have when you come with PPL. The ease of getting started in managing your self-directed services, and then the experience for your peace of mind. So what do we do at PPL that helps you self-direct your services? Next slide. So before we get into talking about the financial benefits, I want to give you a little bit of background about PPL. We've been providing financial management services since 1999, and I've been fortunate enough to work with PPL since 2012, as well as a lot of our other team members who have been doing this quite a while. Public partnerships, we do have some participants who love to participate as real people, and so we also have here Sergio and Asmel Martinez. They've been self-directing with PPL since 2019. We can go to the next slide. So the first thing that we want to call attention to is PPL is going to be your lowest cost FMCS choice in the state of Maryland at $83. So what does that mean? You could choose between $400 and $1,400 per year to use on anything, right? We save you money. And so we want to make sure that you know that if you choose public partnerships, you will be getting the best cost for the services that we're going to be providing to you. Next slide, please. How could you spend that extra money? A new piece of equipment? Maybe you need another service. Maybe you need more hours of care, maybe more respite. So we want to make sure that you know that you'll be able to use that $400 to $1,400 per year to actually buy additional services and supports that make sure that you and your loved one has the services that you need. Here we have another participant, the Colsons. They've been self-directing with PPL since 2018. We can go ahead on to the next slide. Also, we want to talk about some of the financial benefits of working with PPL as your FMCS choice. So we have our daily pay service at PPL. And with that daily pay service, it allows your providers to actually get paid on any day. With daily pay, it is a new service from PPL, and so they'll have access to their money any day where they need to pay their bills, and maybe they need to avoid some late fees, so they'll be able to access those funds on a daily basis as opposed to waiting until the end of that pay period. 2 weeks can be quite a while for some folks, so being able to access their funds fast is pretty easy. There is a fee associated with, which is about 49 cents for the day. So it's a very, very low fee to have access to. And we know that sometimes those fees at banks and different places can be $4, $5, $6, $20 even. So 49 cents is a low price to be able to have access to your funds every single day. The daily pay application is a standalone mobile application, but then also it is integrated with our Time for Care mobile app, which I'll talk about in a bit. And so you'll have access to it, whether you're in our Time for Care app or also you want to just access it on your own through their daily pay application. We can go to the next slide. So now we're going to talk about the ease of getting started. So what is that enrollment process, right? How easy is it to get going with PPL so you can get on with your services and your workers can get paid and everybody can be happy? We can go to the next slide. So in order to get started with public partnerships, you're going to go ahead and reach out to your CCS, which was in the directions earlier in the presentation. And then you're going to have your one point of contact once your CCS makes that referral to PPL. So we have one person who will assist you with your enrollment, make sure that you understand everything. They're going to train you on all of our systems and supports, which are easy, and then make sure that we answer any questions that you have. And that's going to be your PPL enrollment specialist. And once you've completed your paperwork and your training, then you're going to have access to our online portal, our mobile application, and all the other tools that we have, such as our budgeting tool and some other dashboards and things that we do have in our system that will allow you and your loved ones to be and providers to be able to access our system and have your services. Here you're going to see our website, publicpartnerships.com/MDSD. That's where you can go to get all the information that you need about public partnerships and the services that we provide. And then you can also call us or email us. All of our teams are standing by to answer the phone for all of you to make sure that we can answer any questions you have. I'm going to be adding my information into the chat so that you'll be able to reach out to me directly as the account manager specifically for Maryland. Some of you will meet me next week and this week for some of those training sessions and presentations. We can go to the next slide. So next we're going to talk about our My Account system. So that is a user-centered web portal. So we made sure that we got feedback from all of our stakeholders all over the country, all of our 22 states that we support, to make sure that we created and developed a mobile application that allows you to easily use it, get what you need, and not have to worry about all the administrative burden that comes with it. It is very modern and has simple graphics, a lot of buttons that help you and teach you to know, if I click on this button, this is what I'm expecting to be able to see. And so it's very, very easy for you. It has access for case managers, the participants, right, the people that we serve, as well as authorized representatives and your care workers. There is some features that allow for you only and your representatives to view your budget, so your providers won't have access to those types of things. We want to make sure that we keep those things separate, but your providers will have access to the things that matter, such as their timesheets, their check stubs, their W-2s are online as well. So we've got a lot of great features in our My Account system. We can go to the next slide. We also have our PPL Time for Care EVV solution. It is our mobile application that is free on iOS and Android systems. So you'll be able to download this on your smartphones like iPhones and Samsung Galaxies, but you can also download it on an iPad or a tablet, no matter the kind, as long as it's an Android or iOS. And you'll be able to log in using your same login that you use for the My Account system. So it's all one username and password. I know it's difficult to keep remembering usernames and passwords across all the systems. And so you'll be able to go in. Your providers can clock in and clock out. We do location capture. It is only at the time that they clock in and they clock out. So it's just a few seconds. We're not tracking them throughout the day or anything like that. And then there is the ability for them to manually go in and make edits, which we know sometimes have to happen. And then you as an employer and participant have the ability to actually approve the time through that Time for Care mobile application. We're going to be capturing all of the data, as well as if people are actually complying with EVV. So we have this cool tool inside of our EVV system that allows you as an employer to track whether or not your employees are actually using the Time for Care app. And then if they are, you'll see what level they're using it, and you can go ahead and you can talk with them and train them and make sure that if they need help from PPL, we can help them and assist them with any questions they have, so that they can hopefully get to the goal, right, which is the green, of above 90%. We can go to the next. And then we're going to talk about our experience for your peace of mind. Here we have a participant, Teresa McMahon, and her son, who are self-directing since 2018. We can keep going forward. Next slide. So, as I said before, we've been doing this for 23 years. 1999 is when we started. We do know the state of Maryland. So we were in Maryland before. 7 years prior, we were there for 2 fixed contract terms. So we know the population. We haven't been there in a few years, but we're likely going to get back in there and get to know all of your names and your faces, just like we did for those 7 years that we were previously there. We also serve your neighbors, so West Virginia since 2006, Pennsylvania since 2012, and the state of Virginia since 2012 as well. Our address is listed here, so we are getting ready and set up for folks to start coming in and visiting with our enrollment specialists and our information assistance teams, and me. If you want to come in and meet with me as well, you can do that. We'll make an appointment for that. And we just want to let you know that we do know the IDD community, and we're here to support our previous experience in the state, as well as all of our experience across all of the 22 states that we support. We're ready to take it to Maryland again and make sure that you all have the best services and supports that are for you. We can go to the next slide. So just a rundown, we do have those financial benefits of PPL being the lowest cost FMS fee for all of you at $83. We do have our ease of getting going, so we want to make sure that we're empowering you by using our My Account system, our Time for Care application, very easy, as well as having your own one person that's going to help you with your enrollment process from start to finish. And then just knowing that PPL is experienced, and we make sure that we support those in the community to have self-directed services that are easy for them. Next slide.
Thank you, FMCS providers, for your informative presentations. If anyone has questions for an FMCS agency, their names, emails, and contact information are listed here in this slide. A live person will be available to answer any questions that you might have. Next slide, please. The DDA statewide self-coordinator and all the DDA regional SDS leads are listed here. Next slide, please. We also have some resources and tools listed here for you as well. Here is the guidance and forums and webinars link. Here's a DDA FMCS webpage link. We have a link for our training calendar. The FMCS monthly fees are listed here, as well as some other information for your use as well. Next slide, please. Now we'll have some poll questions. Donna?
Hi, good afternoon. Give me a few seconds to start the first poll. First poll is going to be, why did you come to the FMCS Information Fair today? So give you plenty of time to answer that question. We have 4 responses. So we're just going to pause for about 30 seconds. I'm going to wait a few more seconds. Looks like almost 70% have responded. I'm going to wait till we get to that mark. Okay, we're going to close the poll and share our response. So 40% said to learn about each of the FMCSs so that I can make, can't read the rest of it, decision. 47% said to learn about each FMS to help others make decisions, and 13% said that they were interested in the new FMCS agencies, and 0% said that they didn't know. So we're going to go on to the next poll. Let us know what you think about today's informational session. And this is multiple choice again. And now you should be able to pick a response. So we have about 15 more seconds. We'll keep it open. Looks like we have 74% people that have participated. So I'm going to close the poll and let me see. So 40% said it was clear and informative. 46% said it was good. I learned a few new things. 12% were neutral, and 1% feel it's not helpful. We've got 2 more polls. So this next one, and this is for family members and participants only. It looks like 40% have voted so far. We'll keep it open a little bit longer. Okay, we're going to close the poll now and share. So the question was, do you need more information in order to make a choice for an FMCS agency? And 32% said, yes, I need much more information. 35% said, yes, I have a few questions to ask each FMCS. 30% said, no, I think about what I learned. I will think about what I learned and make a decision. And 4% said, no, I'm going to make a choice right now. So thank you for participating in that poll. And we have one more. This is the last poll. Would you attend FMCS related webinars if offered on a regular basis? So easy answers, yes, no, not sure. And we'll leave it open for about 20 more seconds. About 70% have voted. So I hope you'll, if you haven't voted yet, please vote. And I'm going to get ready to close it. Okay. So 67% said yes, they would attend future sessions, and 10% said no, and 23% aren't sure. So again, thank you for participating in the polls. Monica.
Yes, thank you, Donna. I'm actually gonna, you can go to the next slide. We have questions now. And I'm gonna turn it over to Rhonda Workman so she can reintroduce herself and go ahead and moderate the questions. Thank you.
Thank you, Monica, Donna, and the panelists today for sharing all your information. We've got a number of questions, and we'll just go from the beginning on down as they came in for the different agencies and for Christy. So the first question is for Christy. Will family members be tax-free with the national companies as they currently are with the ARC?
That's a great question. So each FMCS will make sure that any employees who qualify for special tax exceptions will get those tax exceptions.
Thank you, Christy. The next question is another program-related question. It is, can you clarify if a credit/funds for the cost of FMCS services will be added to our existing budgets, or do these costs need to come out of currently approved budgets? Currently, we are not charged fees for this service.
That is a really great question. I would first like to just note that we did a webinar about 2 weeks ago on a lot of this information. It's available online. We can make sure that gets to you too. But to answer this really clearly, when people self-direct their services, when they're working through the detailed service authorization in LTSS, they get approved for the total fully loaded brick for the service. So that means that that rate is what traditional providers are paid. In that fully loaded brick, we've listed out this thing called general and administrative cost. Those costs are associated with confirming staff qualifications, paying employees, tax reporting, and accounting processes. Funding to cover these expenses are reflected in service rates, which create that detailed service authorization. And so we are expressing to people that the rates that they are approved for in their DSA need to cover the cost of the FMCS, who does those general and administrative tasks for the person. In that same vein, I think we had a similar question. So therefore, FMCS services would not be included in the detailed service authorization as a service. It could be listed in part of goals and outcomes and things like that, but not in the service to add additional funds to the budget allocation. the funding for the FMCS does need to come from the budget allocation.
Thank you, Christy. So to summarize, the budget allocation for self-direction that's created when a person's person-centered plan is created includes in the total amount of funding cost components that would be associated with your FMCS fee. So therefore, it would come out of your existing budget. Christy, we have another question about effective date. So if you choose January 1st of 2023 as the effective date for your FMCS agency, is that when the new fees will take effect as well?
That is correct. So your effective date when you're doing open enrollment, that October 1st or January 1st, that is when you need to budget for FMCS fees. If you're beginning to self-direct your services, you'll want to budget the FMCS fees for the entire 12 months. But if you're transitioning, it would be from the effective date you choose.
Thank you, Christy. Now we're going to switch to some questions that are specific for GT independents. So Kirsten or Rob, feel free to answer. The first question is, what does GT stand for?
So GT, originally when we started providing, when the company was started, we were called Guardian Track, and individuals confuse that with GT trying to be guardians for individuals within the Medicaid programs. So to reduce any confusion, we switched our name to GT Independence, and it kind of now stands for Go To Independence for all of the self-directed individuals.
Great, thank you. The next question for you is, can EVV, your EVV solution that you were sharing, be done through a computer instead of a phone app or tablet?
So our caregiver app works on any smart device, which includes phones as well as tablets. That device works on with or without the internet. So if you're in a service area where you struggle to get good service, we'll actually capture all the necessary information, and then when you get back into a Wi-Fi or service area, it'll upload. Our app will actually show you by a yellow or green button next to the timekeeping whether it's been uploaded or not. So all the information's right in there. It works with or without internet, which is great to know. Our GT portal works from a computer or smart device.
Great, thank you.
Welcome.
So the next question is, with this app, will the staff be able to put in time when the family check in? Will the support broker be able to help with this for families who cannot?
So the employee themselves enters the time in the caregiver app. So the person that's actually working the shift enters their time on shift. And then to sign off on the time, it can be done right then and there by the participant. Or if somebody else is signing off on behalf of the participant, like a employer of record or representative, they can sign off later through the GT portal or through the app on the device. So there's quite a lot of flexibility to make sure it works for each individual situation.
And I think one thing I would add to that is there's really 3 different ways to help train and ensure people know how to submit that time. So number one, obviously, like Kirsten said earlier, all of our customer service associates utilize the same method to track their hours. So you can always call in for customer support. Built into the caregiver app is a tutorial that is always there on the home screen. So you can always go back and see that step-by-step process as the tutorial shows. And then there's YouTube videos that, are under a minute and a half that walk through that process as well. So depending on your learning type, we're happy to assist in any way.
Great, Rob, thank you. And the next question relates to that. So I'm just going to read the question because the person had submitted it. They say, we have several families, guardians who are not technology savvy. GT trains individual guardians how to use all of this? Question.
So yes, absolutely. During that enrollment meeting with our enrollment specialist, they'll ensure that not only the employee, but also the participant or employer of record or representative are all fully aware of how to use all of the technology that will help them be successful within this program.
And then we offer that ongoing support that Rob talked about just a minute ago. So we just make sure that it's very easy for everybody to use.
Great, thank you. The next question is, can paper timekeeping be available if needed? Some individuals live in rural environments that won't be able to load the app.
So I think, like I had said a couple questions ago, our app works with or without internet. We have onboarded states such as Maine, which is extremely rural, as well as mountainous, which interrupts some of the cell phone signal. We are able to reach 100% compliance across the state. When we sit down and explore, and we really truly will sit down at your kitchen table or meet with you virtually, whatever your preference is, we'll explore how to make it work for your individual circumstance. And with that kind of in-person problem solving that we offer, I'm certain we can become 100% compliant with Maryland's requirements.
Great, thank you. Christy, we have a question that's asking, can we get an at-a-glance comparison of the FMS companies' fees and features?
Yeah, so on our website, I believe it's a link in one of the resources on this slide deck. We have each FMCS's website listed, their fees, and very soon we will include the taxes that if people want to budget very closely to their budgets, they can look at the tax associated with employees, I'm so sorry. So
And Christy, can you share what those taxes are? Can you share the taxes for each agency?
Yep, so GT Independence and the Arc Central Chesapeake are at 14%, and PPL is 12.11%.
Great, thank you. We had a question about why there was a name change from FMS to FMCS. What does counseling refer to? How does the counseling aspect differ from the support broker role? So that's a great question. And the answer to this question is the department issued a request for proposal. So we were looking for new providers. And under that request, it included supports for multiple programs. So the DDA operated waiver programs and other Medicaid programs like Community First Choice. Because of that, then the name of the service and scope changed from fiscal management services to financial management and counseling services. And the counseling services will be under the other Medicaid programs, and the DDA will continue to utilize support broker services under the DDA operated waiver programs. Okay, our next question is for Christy. How long is each pay period? Biweekly, weekly? How long after the pay period do things get issued and checks? And interested in this info for all FMCS providers. Can you talk about our plans?
This is a really great question. The DDA and all of the FMCS agencies are very dedicated to making sure that people do not miss paychecks over this change. Therefore, we're working with the FMCS agencies to make sure that they're all on the same payroll schedule. So if you currently use the ARC, you will maintain that schedule. I will say that if you are currently using MedSource, that pay schedule will change, but it will be the same no matter which FMCS you choose.
Great, thank you. Rob, we have another question for GT. With the caregiver app, could other people see a caregiver that is employed by a self-directing participant and recruit them? Not sure how this works.
Sure, so that's a great question. Through the caregiver app, participants will not be able to see other employees to be able to recruit and hire. But through the GT portal, we have something that's called Caregiver Link that Kirsten talked about, which they would be able to go on. And if any of those employees wish to provide additional hours to more participants, they elect to go on that Caregiver Link registry. And then other participants have the option to recruit, interview, and hire from there. It's not saying that they are able to take employees away from other participants. It's just if they aren't getting a full workload through one participant, they may want to serve 2 or 3 individuals to work a full 40-hour shift or work week.
Great, thank you, Rob. And then now we have some questions for the ARC from when they started their presentation. So Tracy, the first question is, why your monthly fee is double than other 2 agencies?
Sure, thank you, Rhonda. I appreciate that. So yes, our monthly fee is $200 a month. What I would like to share about that is just so that everyone's aware, that's actually a reduction for the ARC. Our current average fee is about $250 because we have a 2-tier fee system, and that average fee is about $250. So this is actually a reduction. And what I would also share is that, please keep in mind all of the value-added benefits that are available to you when using the ARC as your FMCS provider.
Great, thank you, Tracy. Another question for you is, what occurs if an individual, staff, guardian, etc., does not have internet or smart device due to cost of?
Sure. Yeah, so it's my understanding that a smart device is required for the caregiver to use when clocking in this shift. It's very similar to the other systems used by the other FMCS vendors, where the employee would clock in using the app on a mobile device, and the employer would use a computer for the desktop version. I'm not aware at this time of an option where a smart device would not be required, but we're happy to continue to explore other options.
Great, thank you. And this one's in line with that came in when you were presenting too. It says, while all of the technological solutions are great, it assumes that a participant and staff have access to phones and tablets that have the capacity to run the programs. What happens if a participant lacks access to a phone or tablet that can meet the minimum operating requirements for the program?
Thank you. So the EVV requirement is a statewide requirement that all FMCS providers would have to support their participants who use them in meetings. So I do believe that, again, a smart device, it would be required for the employees to clock in and clock out for EVV compliance.
Thank you. The next question for you is, how far along is the development of the ARC software? What happens if it's not working at implementation? Does it affect payment?
Gotcha. So yeah, we've been working to implement FMS Engine since the end of last year. It's a lot of customizations and pieces in the system that we wanted to ensure were a part of the system because of all of the feedback we've heard from our stakeholders. So that will implement October 1st. That is a hard deadline that we are holding ourselves accountable to. And so it will be available at that time.
Great, thank you, Tracy. And the next one, just in case you want to add, is how will the ARC implement the EVV process? I think you just responded, but just wanted to share that.
Yeah, so I'll add that late September, all of the information to those participants who will be serving at that time, we will share all of the videos, put everything online. We're happy to make those videos available in advance, just so everyone has the resources available to them to show them what the app looks like, what approving shifts online looks like. Our FMS engine and EVI is the actual module that's used for EVV compliance. There are many videos that show the EVI app being used from both perspectives. So we'll make those available to folks. We also have a customer service team ready to help in this transition. We know that it might be a bumpy road, but we'll help everyone through.
Great, thank you. Christy, we got another program related question. There's a few of them, so I'm just going to add one at a time. So the first one is, regarding the FMCS fees, are these locked in, or are FMCS providers able to change these fees?
So on our website, we do have the list of the FMCS fees for the next 5 years. Some of them change. every year in July, and some of them don't. But those are the fees for the next handful of years.
Great. The next question is, are there any services or other fees or costs FMCS providers are allowed to pass on to participants that they do not have to include in their services that are covered by the FMCS fees?
I would need to know an example, but I'm going to say no.
Okay. And then the next question is, what are each FMCS's provider fringe rates charged? And you just shared that the PPL and the ARC is 14%.
GT and
I'm sorry,
the ARC is 14%. Mm-hmm.
Yeah, do that. Can you share that again since I just messed that up?
GT and the ARC both 14%, and PPL is 12.11%. I think keep in mind, if you want to be safe, you could budget 14% no matter which FMCS you choose, and know that you might have some cost savings if you use PPL.
And then lastly, related to that, are these fringe tax percentages covered by the monthly fee of the FMCS, or are they a separate cost on the budget?
No, those taxes would be included in the budget like they have been. So when you add an employee line item, you would always include that percentage in your budget sheet.
And Christy, another program question is, if we choose GTI or PPL, will we need to rehire staff?
This is a really important question. No, you will not need to rehire your staff. When you switch to FMCS, your FMCS provider, even if that is staying with the ARC, there will be paperwork for employees to make sure that they can be paid appropriately and that they meet compliance with program standards.
Thank you, Christy. Mm-hmm. We've got a question from a CCS. It says, how does a CCS make a referral to GTI or PPL?
That's great. A referral in LTSS. I am by means no expert in LTSS, but we do have some really great materials on our website from our folks at the department who are experts in LTSS. You go through, we can make sure we get those modules to you. They're on our YouTube as well to be able to watch to see how you assign an FMCS to a person.
Great. And just to add to that, if you go to the new DDA dedicated FMCS webpage, under tools and resources, we do have the training video for CCSs related to the LTSS service referral. And basically through that service referral, on the left navigation, you would go to the self-directed referral, and the 3 providers, as they are getting onloaded and onboarded, will be showing down as a drop-down option in that service referral. But we do have a video available, and that we'll be sure to share that tomorrow with the weekly CCS call. Okay, going down. So Chantel, we've got some questions for PPL. First one is, PPL mentioned any day payday fee of 49 cents or 49 per request. Where would the fee come out of the participant's budget? Are there any other fees that may be charged?
So to answer the question about the daily pay any day payday fee, it is 49 cents. That's actually charged to the provider and not the participant or their budget. So the participant doesn't have to worry about those fees. This is just a benefit, right? An enhancement for the providers if they want to use it. They're not required to, but some people like to have access to their funds before the actual payday, so they'll have that ability to do that. But there is no cost to the participant or to their budget. And then PPL's tax rate, as previously stated by several folks here, is 12.11%, and that is inclusive of workers' compensation.
Great, thank you. The next question is also for you. It says, in terms of using the technology, what are the possible adaptations for individuals that use assistive technology to communicate, individuals that are not able to read print, and people who might be using alternative methods to access technology, for example, switch users?
PPL is ADA accommodating, so we're going to work with each individual participant one-on-one to make sure that we have technology in place that will allow them to receive services. We do have a telephony feature and some other things that we can put in place for participants. But again, we'll work with each specific individual to make sure that we have the service available for them that they need.
Thank you. The next question is, what is PPL?
PPL stands for Public Partnerships. So that is our name. We try to say PPL to shorten it because saying Public Partnerships is quite long. So that is what we are, and we are one of the FMCS choices.
Thank you. Christy, another program question. How do we enroll people new to self-direction? You said not to use the LTSS referral. I think there was some confusion there.
There was some confusion about that. So if you are new to self-direction, you do not need to complete the choice form, that Google form that we have for people who are in open enrollment if they're currently self-directing. So if someone has chosen to self-direct, if they choose tomorrow, they choose one of the 3 FMCSs that are here today presenting, and then you do a service referral in LTSS for that person.
Thank you, Christy. Tracy, there was another question related to EVV. It is, can additional details be provided on what the ARC's EVV system will look like? Didn't know if you wanted to add to what you had already commented.
So there will be a tremendous amount of information shared soon. We have a video series, we have information online to share, and we'll be distributing that to all of our participants very, very soon. More to come. Please keep an eye out.
Thank you. Christy, another program question. For those that have an open person-centered plan in self-direction currently and can indicate FMCS selection via the budget, will an FMCS form be required?
So I think this is regarding people, these special people who have already started a new plan to self-direct in the last couple of weeks. If that is you, you do pick an FMCS, you would do that assignment in LTSS. If you've already started the PCP process, this is where it does get a little bit different. Go ahead and send all of your PCP document and budget sheet over to the regional office through LTSS. We'll review that and get it over to your chosen FMCS. So that's what's a little bit different. If you've already opened that initial PCP, we want you to send everything over to us so we can look at it.
Thank you, Christy. We had another question about the tax differences, but I think we've talked about those a few times. Tracy, another question says, will the ARC use Maryland's ISAS system, or will EVB be through the app being developed?
So EVV compliance will be met through the EVI module of FMS Engine. And FMS Engine is our software that we're working to implement by October 1st. So I believe the ISAS is for traditional provider services, but with self-direction, each FMCS provider came up with their own solution, and we will all work with different platforms and software vendors.
Thank you, Tracy. Christy, program question. How often and when can we change FMCS?
This is a really great question. Part of what we did when we were developing our program standards for the change with new FMCSs was making sure it was as easy as possible to switch between. So we laid out some guidelines with all the FMCSs on how that process will work. I'm so sorry. The only difference is we want to make sure people are transferring on that tax quarter if they're currently using an FMCS, so that it's as easy as possible to make sure employees get those tax documents they need.
Thank you, Christy. Tracy, another question for you. Will the ARC still use Paycom, or will they move to a different platform with the addition of EVV?
Oh, that's a really good question. So Paycom will be our payroll processing provider only. So yes, paychecks will be distributed through Paycom. However, EVV compliance will be through the FMS engine module called EVI, and that's all integrated into FMS engine, which will also provide the platform and the self-service portal. That's all the software platform doing that work, doing the behind-the-scenes work, whereas Paycom will just be distributing the paychecks. It used to be different, so that's going to be a transition that will occur in October.
Great, thank you. Christy, another question related to new hire packets. Do new hire packets need to be done again if the participant transfers to a different FMCS?
A great question. Maybe. So it might be that the new FMCS might need some new paperwork to be completed. In our webinar about 2 weeks ago, we talked about how there will be some correspondence between your current FMS and the new FMCS. So there will be some exchange of documents in that way, including sending over the participant your employer identification number. We want to make sure all that paperwork gets over. But in that process of making sure that employees are prepared and can get paid and do meet qualifications, there may be some paperwork that employees will need to complete.
Great, thank you. The next question is to each of the FMCSs. So I'll ask the question and then I'll ask each of them to share a response. So the question is, will the web portal be available for the support brokers with the 3 FMCSs? So GT, if you would like to share first, if support brokers will have access to the web portal.
Thank you for the question. Oh, can you hear? Okay, thank you for the question. Our real-time web portal is available to many different types of users. So the participants, the caregivers, the case managers and CCSs, and then the support brokers are able to go in with the participants and view their information that way as well. So we have all the different types of views that make sure all the right information is available to everybody, but it also maintains that privacy, for the participant.
Great, thank you. And now Tracy, can you share, will the web portal be available for the support brokers with your agency?
So yeah, the self-service portal, the participant dashboard will be accessible by the participant and their team. So that includes anyone who would want to access that on behalf of the participant, to whom the participant is granted permission. That does include support brokers and CCSs as well. So when support brokers log in, they will have to choose the participant, and CCSs will do the same thing for full access.
Thank you. And PPL, can you share, will the web portal be available for the support broker?
Yes, so our system, similar to the other two, allows for support brokers or the individuals on the participants team to have access and view, as long as they give them that specific access, to be able to view their information. And also, they will be able to have selected access to certain things unless that participant gives them the ability to do so.
Great, thank you. Another question that we'll do the same, we'll go to each of FMCS in the same order that we've been doing today. So the question is, will there be in-house training for the new EVV system? So GT, can you share, will you do in-house training?
Yes, thank you for the question. We do, during the enrollment meeting, offer in-person or virtual, depending on what the participant prefers, a full training for the participant as well as the caregiver, the representative, employer of record, and anybody else that attends the meeting. In addition to that, we have live support through phone calls and live chat. We have printed material and we have extra material on our website, which includes video and printed material.
And the only other thing I would add is if there was a request from a family or a provider for us to go back out after the initial enrollment, we're happy to assist them in scheduling another in-person meeting.
Great, thank you. Tracy, will you share, will there be in-house training for your EVV system?
Absolutely. So FMS Engine, who holds the EVI app, which is responsible for EVV, FMS Engine will be providing external folks a webinar to provide information about how to use the EVI app. We'll also have that webinar available on our website. Again, there's a video series and a lot of informational, supplemental information available for training purposes. All will be available on our website.
Great, thank you. And PPL, will there be in-house training for your EVV?
Yes, Public Partnerships offers training at that initial enrollment session with the enrollment specialist. We also have videos that are actually on our YouTube channel, on our actual webpage, and then also we offer the opportunity in the future for people to be trained. So we can have enrollment specialists do additional trainings in the future, and we'll also make sure that we have some webinar series that kind of go throughout the life of the program, and it will touch on EVV. So families will have the opportunity to access that at any time as long as they're on the schedule. They'll be able to log on and access those trainings.
Great, thank you. Christy, a program question. Do fees come from unallocated funds?
That's a really great question. For most people who currently self-direct, they have plenty of unallocated funds to account for the FMCS of their choice. If a participant does not have the unallocated funding in order to pay for FMCS fees, they will need to decrease part of their budget. In our webinar 2 weeks ago, we went over a couple of options. The first would be if you haven't done a revised plan to receive those July 1st rates, you could do that, and then your budget would go up. Or you can decrease wages. The wage of employees or vendors. You could decrease mileage rate or the number of miles or individual and family directed goods and services, with the exception of recruitment.
Great, thank you, Christy. So here's another question we're going to ask each of the FMCS agencies. So the question is, do all FMCS agencies have an employee hiring search for one-to-one staff needs, or does only a particular FMCS have a system to help employ, interview, and hire one-to-one staffing? So the question is do you have, as part of your, supports and tools, assistance with hiring staff related to it? So GT, we'll start with you.
Thank you for the question. We have, during our orientation training, part of that training includes how to hire and manage your employees, as well as who is eligible to be an employee. So we go through that extensively with the employer at that period of time. In addition to that, we offer ongoing support through our customer service, which Rob had said earlier in our presentation. They are fully trained in understanding of the Maryland rules, so they can help people. You get kind of the same group of people every single time you call in. In addition to that, inside of our GT portal, we have resources, including resources on how to hire and recruit individual employees, and how to interview and how to manage them throughout their employment period.
And then that solution that we have, the Caregiver Link Directory, will be there available for all stakeholders to be able to use. We can either vet that list for individuals and say there's a list of 20 individuals within a 5-mile radius. We can vet that for maybe 3 to 5 individuals who are looking for work and provide those names and contact information to the participant. Or if they prefer to vet it themselves, they can do that too.
Thank you.
Great, thank you. Tracy, can you respond to that too, in terms of does your agency have employee hiring search and assistance related to employing, hiring, and interviewing?
Absolutely. So we have numerous employer resources available on our website with regard to new hire onboarding. Lee and her team oversee the onboarding process, so they're available via our customer service ticket system. Just put in a ticket, the team is happy to help you. We're also going to be developing webinars for how to onboard new hires and vendors. And then lastly, I would add that the self-service portal, which is part of FMS Engine, will also be up and running this fall, and the self-service portal will literally walk you through the hiring process to where you won't be able to submit until everything is complete, and that way the team can expedite the processing of those new hires.
Great,
Lee,
thank you, Tracy.
I was just going to add that this is Lee's wheelhouse. I want to give her an opportunity to add anything.
Oh, I think you covered everything. Thank you.
Great, thank you. PPL, can you share if your agency will be offering an employee hiring search and what assistance you'll provide related to interviewing and hiring?
So because we do have that one-on-one assistance from our enrollment specialists, they'll actually be going over that process at the start of the services and going over the information that we do have related to that in our actual handbooks. And that's also going to be there always for participants, for them as a guide, and then they'll also be able to contact their enrollment specialists as well as our customer service team. They're well trained for this information as well. And then our My Account system does have a provider directory associated with it. So it allows for employers the opportunity to connect with providers and providers to connect with employers. And then the providers can log in through their portal, right? They have their own username and password. So each of them will have different views, but we do offer those tools for them to be able to access that.
Great, thank you. Another question that we're going to ask each of the agencies. The question is whether it's possible to see the applications that you're talking about to try out on a trial basis before the person needs to make a decision. So they want to be able to see what the system looks like and see how user-friendly it would be for them. Do you have any options for that? So we'll start with GT.
Great question, thank you. So there's a couple of ways. So number one, at the resource fairs, if you're able to make it to one of the resource fairs, we'll have the application there for you to be able to trial that out and see how easy it is to clock in and clock out and gain shift approval from the participant. The other options are those videos that we have online to be able to see that. Or we could set up a video conference call and kind of share our app through a video screen so that you could watch someone clock in and clock out as well.
Great, thank you. Tracy.
Thank you, Rhonda. So we will also be able to share that information at the resource fairs. I think we'll have a lot more handouts to provide with really, screenshots of what the app looks like and that sort of thing available there. We'll also be adding a lot more information to our website with regard to FMS Engine and the EVI module, as well as the participant dashboard and the self-service portal. Those are all pieces that will truly make self-direction so much easier than it has been. It's really about adding that level of transparency to everything that we do. And so you're not always wondering where things stand. You know exactly where things stand. You have that information at your fingertips. Those resources will be available online.
Great, thank you. And PPL.
Yes, at PPL, we do offer in-person trainings. We're going to be at the actual informational fairs as well. So we'll have videos running and actual demos available for people if they come up to us. As I said, our enrollment specialists will do those demos. And then also we have videos on YouTube. I have no problem assisting people if they reach out to me and say they want me to do a demo with them. I definitely can. I can screen share and walk you through all those steps as well as other members of our team.
Great, thank you. We had a question, will the slide deck be emailed to us for referring to, especially for the contact information? So a couple things, you can download the slide deck, it's in the right panel. In addition, we will be posting the slide deck with this webinar and tonight's webinar on the DDA dedicated webpage for self-direction, so that you can go back and review and refer at any time. The next question is for GT Independence. Where is GT Independence located? Are they in Maryland?
There I am. Good afternoon, and thank you for the question. We do have an internal facing office already established in Riverdale, Maryland, and we're in the process, probably in the month of August, to have another second office in Maryland as well.
Great.
And that second office will be external facing for the public to be able to come in as they need to.
As well as the fact that we do majority of our business at the location of the participants choosing. So our business model has always been to come to you rather than to make you come to us. So no matter where you want your business to be held, we're happy just to come sit at your kitchen table, meet you in a common public setting, whatever works best.
Great, thank you. Christy, can a budget be revised to cover the FMCS fees? Some of us do not have any unallocated funds.
Yeah, so like I mentioned, if you have an approved PCP that was approved before July 1st, you can revise that plan to get the July 1st rate, because many of the rates for the service went up. So if you have it, if you have that, you can. But if you do not have unallocated funds and you're using the July 1st rates, what you'll have to do if you don't have unallocated funds is to change some of your line items around in order to fund the FMCS.
Great, thank you.
Regional offices are available to provide any technical support you need in order to do that.
Great. The next question we'll do for each of the agencies. Are times done electronically or are paper timesheets an option with any of them? So for each agency, do you accept electronic timesheets and do you accept paper timesheets? We'll start with GT.
Thank you for the question. Because Maryland is moving to EVV compliant record and timekeeping, using the caregiver app is the way to achieve that compliance. That being said, we've worked with a lot of very rural states and we've been able to resolve that for 100% of the people. Our system works both on and off the internet, so people are able to capture the timekeeping elements they need to, and then when they're back into Wi-Fi, like say you go to McDonald's with free Wi-Fi or the library, there's so many ways that we can help people figure that out, and we've been able to do that in many states. Thank you.
And we're able to do that through, for those individuals who do not have a device, we do have devices available to provide for individuals to be able to access the caregiver app that we utilize. If there were any exemptions to EVV and the program allowed for those individuals who were exempt from EVV to use paper timesheets, we would accept those, but that would have to be approved by the program.
Great, thank you, Rob. Tracy.
Thanks, Rhonda. Yes, similarly, with the state's requirement for EVV compliance, we are no longer able to accept paper timesheets. That's just in line with the program requirements that are aligning with federal and state requirements for EVV. I will add, though, that if there is an exemption process that the state allows, we would review those on an individual basis and be able to provide support to the team to determine, if that eligibility criteria for that exemption meets if they fall into that criteria or not, and then support them in that way.
Great, thank you. PPL?
Hi. It was taking a second for my screen to get back up. Sorry about that. PPL does offer our Time for Care app. Unfortunately, it is a requirement that that application is used. We can work with families on alternative methods, such as our telephony option. Again, there are some circumstances that will warrant individuals to use that application. Our Time for Care app does allow for offline mode, which is what we call it. So if someone is in a rural area and they don't have access to the internet or something like that, it will still capture all of the required information in that rural area or area that doesn't have a signal, and then they can go, once they go somewhere where they have Wi-Fi or a better connection, they'll be able to actually have that information uploaded into our system. And then, as I said, our telephony option is available for those individuals who meet the requirements and criteria to need to use that. But we have been able to work with almost everyone in all of our 22 states to be able to make sure that they are compliant with EBB.
Great, thank you. Christy, there's a question here that says, what's the turnaround time to complete these changes through DDA going to be? Can you talk about what's happening now that it's August 1st and take us through January 1st?
Yeah, it's a really exciting time in self-direction. Let me say that, right? So right now, open enrollment has begun. People who are currently self-directing, they have from today until November 15th to make an FMCS choice. On November, so that choice means they their CCS completes that open and the FMCS choice form, and they do the assignment in LTSS. If that's not completed before November 15th, on November 16th, the DDA will assign FMCS agencies to people. We really want to make sure people are making that informed choice. So you're going to hear a lot from us. We have a lot of options for how to learn about FMCSs. In August, we have once every week this month, we have a different informational session in a different place, like Monica mentioned earlier. We'll do that again in October, including another virtual information session too. So you'll have plenty of time to learn. Then on November 16th, those who have not made a selection will assign them. And then everyone will have either started their new FMCS services on October 1st or they'll begin on January 1st.
Great. Thank you, Christy. For GT, the question is, how many clients does GT serve?
Thank you for the question. GT Independence currently serves over 40,000 individuals in 20 states.
Great, thank you. Question for PPL. PPL offered services in Maryland for 7 years. Why did they halt services in Maryland?
Thank you for that question. So at that time, the contracts actually ended and there were some changes at the state level. So we are now ready and back in the state to assist, but those contracts did end at that time.
Hey, I'm just going to add something to that too. That was, excuse me, that was a decision made by the state of Maryland when the Department of Labor deemed them a joint employer. So during that other contract. And that's why the contract ended.
Great, thank you.
Sure.
So question for each of the agencies. Are these agencies non-for-profit? So GT, can you share a non-for-profit agency?
Thank you for the question. GT is a for-profit agency, but again, like we spoke earlier, our goal is to provide as much of the budget to be allowed for those participants to be able to utilize on either their employees or any goods or services that they have within their plan.
Great. Tracy from the ARC?
Thank you, Rhonda. Yes, the ARC is a nonprofit agency with a 60-year history providing services to Marylanders. I would add that when we do realize a profit, we add that back into our service delivery model and create opportunities for grants and other awards for those we serve at the ARC. Thanks.
Thank you. PPL.
PPL is a for-profit organization serving the state of Maryland. If there's any other questions, feel free to reach out.
Great, thank you. Christy, there's a question. If you're already with an FMCS agency that you plan to stay with and you select the effective date of January 1st of 2023 for FMCS services, then will the FMCS monthly fee start in January of 2023?
Yes.
Tracy, another question. Does the ARC have mobile apps like GT and PPL? FMS tools coming mentioned in slides, how soon? And last but not least, The ARC mentioned they would adapt new program requirements, but they did not disclose exactly what these new requirements were.
Sure. So let me answer the app question first. So EVV compliance is, yes, met with an app. The app is part of a module of our new software platform that we're implementing in October. It's not available now, but it will be available in October. We've been working the last 8 months to get it ready for you so that October 1, we have it ready to launch. And EVI is an app that will ensure EVV compliance. I'm sorry, Rhonda, can you repeat that second part of the question?
It wants to know if you are going to disclose exactly what those new requirements were.
Oh, okay, yeah, so the new requirements are speaking heavily toward the EVV compliance requirement, which is now a statewide requirement based on state and federal requirements for EVV services.
Great, thank you. GT, question for you. Has GT already hired customer service representatives in Maryland?
Thank you for the question. We do already have customer service representatives up and running. We're ready to receive referrals today for any person that is either going to transition to our company or a brand new person self-directing.
Great, thank you. There's a question, do each agencies assist with the med tech training and other required training for staff? Christy, can you address that from the program perspective?
Can. Training continues to be a line item within people's budgets. They can, if their employees are required to have training, they can pay for that training. A couple of weeks ago, we added the ability for people to be paid for going to that training in that line item. Additionally, we added other options for trainings that people might require of their employees, like MANT training or ACRE training, things like that. But those continue to be a line item in people's budgets, and they would need to support their employees to get the training they need.
Great. Christy, another question under FMCS, who will pay support broker fees for the self-directed service participant? Who's paying the fees and where does it come from?
Support broker services also continue to be a line item within the budget, so nothing has changed in that regard. Support brokers would either submit a timesheet to the FMC to the person who approves it, or an invoice to the person who approves it, and the participant would send over the invoice or the timesheet to the FMCS for payment.
Okay. Let me just look to see here. Some of these are repeats, I'm just going through them. People appreciated the poll. More questions about the paper timesheet, which we've addressed. There was a question about the added value for the ARC's $200 fee. Tracy, I believe you've noted that in terms of your fee. Question about, will tablets be able to be purchased through the budget if participants does not have funds to purchase one? Christy, you want to talk about our assistive technology service and options that are available to people?
Assistive technology also continues to be a line item within the budget should people have an assessed need for it. We can, I think, if we have questions that are specific to people, I'm happy to talk to them about the waiver requirements and what that might mean as far as assessments and things like that. But
there's a question about what if an employee does a shift change in the community? Example, meets the participant and other staff or parents somewhere to start a shift. How do they clock in without it appearing fraudulent. So I think you would clock in and clock out for your appropriate shifts. It can be in the home or it can be in the community. Christy, last program question, because I see we're getting at the 2 o'clock time, but what impact is there by choosing either October 1st or January 1st when your budget starts in July? So what's the benefits or things people should be thinking about for October versus January?
I think this is a really important question. I think keep in mind from the beginning of our webinar, we talked about the difference between fiscal management service and financial management and counseling service, that this is a new service with added benefits, including these web portals, the accessibility. Those are the services that would be paid for through the FMCS line item. So that would be the benefit. One of the benefits of changing in October. Another would be if you're ready, if you want to make a change right now, feel free to do it. We just want to make sure people have the flexibility to take as much time as they need to get to that January 1st date, or if they are ready to make a choice, to do it on October 1st.
Great, thank you. And Monica, I see we're at 2 o'clock. We'll turn it back over to you.
Okay, great, thank you. For closing remarks, can you just move to the next slide? Thank you for attending the FMCS Informational Fair for virtual kickoff today. There are in-person sessions planned throughout the state during the month of August, and so please register via Constant Contact if you're interested, and let us know if you require any special accommodations. Also, masks are required to attend and will be available at each site. Additional fairs will be scheduled in October. More information will be provided in the coming weeks. Visit DDA's web pages for upcoming events. Also, check with your regional office lead who can provide you with more information and help you register for any of our events that we have coming up. Again, thank you all for attending the training today. And remember, we'll see you back at 5, okay? Thank you very much. Have a good day.